Yes, Commission, we have one work session item tonight, and with us is members of the Clark County Combined Health District to talk to us about the tobacco retailer licensing policy and enhancements. With us is Chris Cook. He is the Health Commissioner. And then we also have Leah Baylor, who is here. She's a health planner with the Health District and also focuses primarily on the tobacco prevention and cessation program. So with that, thank you, Chris and Leah.
Absolutely. Good afternoon, or good evening, Mayor, City Commissioners. We're going to talk a little bit tonight about a topic that we have talked to you about before in the past. It's tobacco, it's nicotine, it's cigarettes, it's vapes, and the impact that they're having on our community's health, and specifically our children, my children, who are growing up here in Clark County. So the person that I want you to hear from tonight is actually not me. It's Leah. And Leah's going to talk to you here. Leah is one of our health planners, more commonly known as a health educator at the health department. She works in the programs of compliance education and cessation when it comes to tobacco, nicotine. She's got a little show and tell tonight too. You probably see this big tote of stuff up here. We'll get to that here in a moment. But I hope you find that impactful. She's going to share some data with you tonight as well, and some things that we hope that you'll consider going forward for the city of Springfield. Recently, Leah had an opportunity to talk to the House Finance Committee. Actually, that's tomorrow. And she talked last week to the House Health Committee. So she has been representing Springfield and Clark County very well at the state level. The TRL, tobacco retail license, it's something that has been on the books here in Springfield since 2021. And it has been a great tool for us at the health department, but I think we can go further with some possible enhancements that we're going to talk about here tonight. My hope is that you come away with two things tonight. Number one, I hope you have an emotional response, whether it's anger, disgust, sadness for our community and our kids. I think if you don't come away with an emotional response, I would encourage you to check your pulse and your priorities, because this is going to generate that tonight. Second thing is, I hope you have an appetite for action after this tonight that we'll talk about in the coming weeks and months. So Leah, all yours.
Okay, thank you so much for that introduction, Chris. I want to say good evening to the city commissioners, and thank you so much for this opportunity here tonight to speak about this important topic. I think Chris really highlighted it well, saying that we hope that the message that you come away with is learning more about the deep issues of youth tobacco use here in Clark County, and then also walking away with support for enhancements to our current implemented TRL. Just want to make sure this. Okay. So for those of you who might not be familiar with what the tobacco retailer license policy is, here's just a little bit of details about this policy. So it was passed in October of 2021, and it was actually implemented in January of 2022. Retailers must purchase a $150 tobacco retailer license to sell any tobacco-related product, including paraphernalia. So that includes not only tobacco products, but any kind of accessories, including tobacco papers, holders, any kind of preparation, or tobacco storage. This policy includes e-cigarettes. So some current tobacco policies do not include e-cigarettes, but this one does. So it's updated to include that. They must apply yearly through the health department, and failure to comply with obtaining a tobacco retailer license will result in a first, second, and third offense consequences. So why is this an important issue, and why is the health department really pushing to address this? So there's public health and there's community benefits. So this tobacco retailer license is really important. So what it can do, it can protect youth from early exposure to addictive nicotine. So many of us probably growing up have heard that tobacco is considered the gateway drug. So this also enforces local responsible tobacco sales. It supports 100% ID checks for all tobacco-related sales, and it encourages a healthier a community environment. It helps decrease prevalence of substance dependency in our community, hence talking about the gateway drug. Unfortunately, youth start with nicotine, and that can easily evolve into using harder substances. And it decreases healthcare costs. So unfortunately, treating tobacco-related chronic disease is expensive and can be burdensome to our healthcare system. So some of the proposed enhancements, we have a really great tobacco retailer license implemented already, but we really want to further and strengthen it. So here's some of the proposed enhancements that we're hoping to have support for. We're hoping to increase the fine to $1,000 for the second violation within 2 years. We also want to add a third and a fourth penalty consequence structure. And we also want to entertain a density and proximity clause. So we have a lot of youth-based organizations here in our area, and limiting tobacco retailer licenses within a certain distance of youth-based organizations can decrease access and availability to youth. And proximity clauses, too, are important. Okay, so why are we really pushing for this? So the data really speaks for itself. So here's a little bit of data that we got from our Youth Risk Behavioral Survey of 2023 at the Health Department. We conducted this survey with about almost 4,000 students from around Clark County in high schools and middle schools. This data is taken from high schoolers. So what we've found is that 16% have tried smoking a cigarette in their lifetime. 7.9% smoked a cigarette before the age of 13. So we know we have the T21 law in place, which means that no one under the age of 21 should be able to purchase or access tobacco products. We have youth in our communities who are using under the age of 13. 3% smoked a cigarette in the past 30 days. 28% have tried an electronic vapor product. 13% have used an electronic vapor product in the past 30 days. And 5.9 have used an electronic vapor product at least 20 times in the past 30 days. So I feel this data is really compelling and speaks for itself. So what does the tobacco retailer landscape look like here in Clark County? We have 130 tobacco retailers in Clark County. We have about 87 tobacco retailers in Springfield City itself. So to put that into perspective of some other essential services that we can access here in Clark County, we have 15 fitness centers, 22 grocery stores, 18 child care centers, and 9 urgent care centers. This is a part of the handout that you have at your seats. This is a really accurate representation of tobacco retailers that we have here in Springfield City. This is point densities. So if you look at these maps, the red flags represent a tobacco retailer, and the little black building there represents a youth-based organization. So this is highlighting the saturation of tobacco retailers that we have in close proximity to youth. These maps highlight just kind of a further out look at the county itself. And then you can see, compared to the rest of the county, just how dense the tobacco retailers are in Springfield City. So that massive cluster in the middle of the county represents tobacco retailers that are located in Springfield City itself. I think it's important, too, to highlight that tobacco retailer covers just the city of Springfield jurisdiction. So that's why having this tobacco retailer license in place here for Springfield City is so important, because that's where the primary saturation of tobacco retailers is. And that's where the highest level of access points are for our youth. So compliance checks, we conduct compliance checks a few times a year at the health department. And some of our findings that we've collected with our data, comparing those different compliance checks, showed kind of before and afters of tobacco retailer license fine enforcement and implementation. So before fine enforcement, we kind of had the first year piloting this program, or this policy, I should say, where we were taking the time to educate retailers of this new policy. So there was not the fine enforcement for that first year, but we still conducted the compliance checks. And what we found is, out of 84 stores checked, we had 29 that failed. So we had a 35% failure rate with that compliance check. So the next year we did another round of compliance checks, and we compared that to the first year of that pilot year. And after we started enforcing those fines, we found that the number of failure rates drastically decreased. So we actually compliance checked 86 stores this time, and 7 failed, which resulted in an 8% failure rate, which really highlights the importance of enforcing these fines. So the fines work, which is our conclusion, and really supporting those enhancements and making them stiffer and higher penalties can really just benefit this policy altogether.
Of the 7 that failed in '23, were all 7 also failures in '22? Do you know? So these are 2-time losers?
I'm going to say that that's most likely correct, although I don't have that exact figure for you, but I'll be happy to provide that after.
Well,
the
it would
meeting.
seem very germane to one of the proposals you're making in terms of a second fine being stiffer. If we have some evidence that this is occurring, then I think it lends credence to the need for it, because obviously the first time around they didn't learn the lesson. Thank you.
Okay, so the compliance check outcome conclusion is that number of compliance check failures significantly improved from 35% to only 8% compliance failure when fines were enforced through the TRL. And the closing message is tobacco retailer license is a helpful tool to ensure retailer accountability in following the unlawful sale of tobacco to minors, and enhancements are necessary to maximize protecting the community's children from access to addictive nicotine products. Tobacco retailer license enhancements can act as an effective deterrent for underage tobacco sales, and support for enhancement efforts help our community. Okay, and that's the end of the presentation. And really quickly, I just kind of want to draw your focus to this bin of vapes here.
Oh,
And so
that's
this-
not a box of candy?
No. Yeah, the tobacco industry would like you to think
No,
that.
I know. That's
Yeah.
why I'm saying it definitely looks appealing
Yeah.
to a younger eye, for sure.
Absolutely. So just a few details about this. This is about 35 pounds of confiscated vapes from one high school here in Clark County. This is about a 6 to 8 month collection of vapes that were confiscated from students between 9th and 12th grade.
And then what
So-
about the difference between the actual nicotine use and also THC usage?
Right. So primarily, we're still seeing nicotine products confiscated, but the products containing THC is on an uptick.
It's on an uptick.
Yeah.
Thank you.
So there's a variety of products in here. So these were confiscated from school resource officers and given to me as to use as a visual campaign to highlight the issues of what is occurring in our schools in Clark County, which really highlights the need for enhancing policies like this. I know that when I talk to school administrators and school resource officers and teachers, they're pretty much, they're at a loss on what to do, and they really need help.
The addictive nature of vapes is like how much stronger than an actual smoke cigarette?
Yeah,
How much,
absolutely.
how many times stronger are the likelihood of addiction to vaping?
Right. And as time goes on, these products are evolving to become more technology based. These products are starting to turn into gaming systems where they have LED screens that you can play games with each other. So the more times that you puff on a vape, the more you're interacting and earning points on this game. And then also there's some features on these products called smart vapes that they're an interactive virtual pet. So if anybody remembers the Tamagotchi virtual pets, they're now featured on a vape, where the more that you hit the vape, the more that it's feeding your pet and playing with this pet. So the tobacco industry would like you to think that these products are designed for adults, but I think the design behind these products speaks a different story.
I'm a former cigarette smoker. I quit November 7th, 1989, at the urging of my wife and daughter. I know how addictive cigarettes are. I can't even imagine how addictive vaping must be. But I know how hard it was to give up, and anything from my perspective that we can do to protect the young people of our community, we should take advantage of it. I am pleased with the results, and I hope by adding some of the things that you have recommended, we can even improve them further. So thank you so much for sharing that with us, and also for working in this community to help our young people not get trapped like some of us were when we were younger. So thank you.
I would also like to highlight that these products are increasing in nicotine content. So a traditional cigarette has about 20 milligrams of nicotine, and these products here can have anywhere between 20 and 50 milligrams of nicotine. They also contain anywhere between 5,000 to 20,000 puffs. So some of these products can be the equivalent of anywhere to 500 to 1,000 cigarettes.
Now, I'll ask Leah to share. I'm looking at a couple here, like Mr. Fogg. I would say these are very affordable, unfortunately, as well. Do you know what the price is? I mean, we've had people go in and make these buys illegally. We don't have to give them much cash because it doesn't take much to get these.
These products are priced between $12 and I would say $18. So under $20.
And then a pack of cigarettes is what, $8?
Anywhere between $4 and $6.
4 and 6. Okay. Wow.
I know over the years of learning so much from you about vapes and cigarettes in general and smoking, I remember a story that just kind of stuck out with the times that we were having conversations, and I still carry it forward. I remember hearing a story of kids getting the vapes and then creating businesses and reselling them to other kids within school. And that was just one thing that was just so shocking to me. And same with adults doing the same thing in their near schools that were doing it, referencing the story that we were talking about. So when you look at the enforcement, what does that look like when you go out for compliance checks and the enforcement? We're talking about increasing it to $1,000 fine, right? On the first offense, $1,000 to a retailer, probably nothing compared to what they're selling. So if you could talk a little bit about what enforcement looks like, and maybe even mention, and maybe you shared this, but the retailer growth we've seen just in the past few years, and especially with the THC, see all the flags and the signage. Maybe you could even talk about the signage, because I know I've heard you say comments about that before.
Yeah. So I think currently the amount for the first fine is $500. So it would be increasing from 500 to 1,000. Yeah, that can be to certain retailers, depending on how much business they're doing, kind of pale in comparison. Or sometimes you hear the saying, it's the price of doing business. So, we're trying to just kind of realistically raise the fines, what we can do. So, that's kind of the mindset with that increase. Hopefully with a combination of increasing fines and retailer education, we're hoping that can be effective going forward with reducing underage sales. Also, sometimes word of mouth is really effective when retailers get wind that enforcement's being stiffer and fines are growing, that can be a deterrent for selling to underage youth. And I hear stories too at the health department. I have parents calling, they've definitely called in the past, really kind of pleading with us to do something. And this is really just the course of action that we have the ability to do, is trying to go the policy route and the education route.
What is the fines for selling alcohol underage? No?
That is a great question. Unfortunately, tobacco is just my only lane here.
Yeah. Right.
But
Be
I'm not
interesting
quite
to
sure.
know. Yeah. Thank you.
2 weeks ago, I was waiting for something for food with my youngest, who's 8 today. And we're in front of one of the vape shops in town, and it's bright lights and colorful. And my 8-year-old's asking all kinds of questions about what is that? But yeah, I guess I'm just saying highlight the attraction that this little person was just, kept looking in and wondering what it was. And the struggle I was trying to explain without too much of judgment, but just trying to explain what it was. And so anyway, I'm hoping there is a lot more that can be done to keep this from getting in the psyche of these young people, to keep the interest up. I mean, I hope that goes away. That's my hope. Go ahead, Tracy.
With signage, like you're
Yeah, wasn't
talking
there-
about, I mean, are we seeing that rule breaking too? And what does a consequence look like with that signage?
They have festival lights, like LEDs
Right.
everywhere now.
And that's something
Cover
that
the
we're
windows.
pursuing, maybe something within zoning that we could address signage. Signage
Yeah.
is a really effective tool for attracting customers, especially kids. I don't know if you've noticed, but there's an increase in the LED lights in storefronts. There is a vape shop that I could probably walk to from the health department in town, and I've noticed a significant increase every time I drive by in the morning, that there's signage just popping up in those windows. So hopefully here in the near future, we can maybe address something within our zoning about signage. We have other communities in other counties that actually do not allow signage for tobacco products in their convenience stores. So I feel like that's another strategy for an effective deterrent.
This is something the Partners in Prevention have brought up and brought to us, but we've not moved on that yet. Is that right? It's not been.
It's part of, so as we are redoing the zoning code, the sign code falls within there. And I know that the piece of it, and Steve Thompson actually just shared information with Partners in Prevention the other day about how it outlines there.
Okay.
Mayor, you mentioned the attractiveness. You thought it was candy at first, and what you don't get up there is the smell. Now, to me, it's nauseating, first of all, but the combination of all these smells, it's pretty rough. But individually, I mean, you can't tell me that these aren't being marketed to our kids. Fruity Pebbles, I mean, come
Right.
on. I mean, I like a bowl of cereal, but at the age, I'm not eating that anymore. But
And I don't think
for
the health
kids,
commissioner is going to have Fruity Pebbles. But
no,
anyway.
no, definitely not. But I was going to ask Leah to share one more very quick quote. When we're asking kids about the ease of access to be able to get a vape, one of them said something that was shocking to me when Leah told me the story. I had her tell it to me again because I wanted to make sure I understood what the kid really said.
Yeah, so you have a postcard up there too. It was another handout that's included. And there's a testimonial on there. We did an activity with youth. It's an after-school program, and it's writing a postcard to the city commissioners, just kind of telling from their perspective how easy it is to access tobacco products here in our community. And I believe the quote that Chris is referring to is that I did a presentation in one of our local high schools in the health class, and I kind of did just a very informal poll of those students. And I asked them, I said, on a scale of 1 to 10, how easy is it for you to access tobacco products? They all laughed, and they unanimously agreed it was a 12. So kids who are between the ages of 13 and 18, have incredibly easy access to addictive nicotine products here in our community. So also with these products too, they come in all kind of shapes and sizes too, and a lot of them look like toys. I have a vape here also that looks like a keychain teddy bear. So these products are really designed to be concealable too, which some of their names are actually, a brand is called Hide. So I don't necessarily think that to me resonates that that's designed for an adult. So these are really addictive, easily concealable products that are very colorful. They have really fun flavors, and our youth are just kind of like moth to flame with these products right now.
Any other questions from commissioners?
What's the call to action, Chris?
Go ahead. No, please, go ahead.
The call to action is please support the tobacco retailer license enhancements. I really think this is a great benefit to our community and our youth and, making an investment in the future of Clark County.
We have a lot of folks that come in here with a lot of different issues. And I just wanted to say that I brought a sheet. This is all of your elected officials and who you can write and contact with anything that you want with your concerns, or give them a high five through the mail if you'd like. But this is a good tool to have to contact your representatives for this issue. Thank you.
Mayor, I just want to end with, I don't think I'm being overly dramatic when I say our kids are under attack. And it's our job to do anything that we can to give them every opportunity to be healthy for a very long time.
Absolutely. Thank you so much for your presentation.
Thank you.
Okay. We'll just.
That's
anything
our
else?
only work
Okay.
session item tonight.
Great. We'll start the formal meeting in just about a minute or 2 minutes.
Do we want to adjourn?
Yeah, is there a motion to adjourn the work session?
So moved.
Second.
Been moved and seconded. Clerk, call the roll.
Dr. Estrop,
Yes.
Mrs. Tackett,
Yes.
Mr. Rube.
Yes. Okay, we'll start in just 2